So moving along to the next topic, the next one is telemedicine. And what do you think of telemedicine in 2040?
That's an interesting question, and I think I'll put my creative hat on because it's more of a personal prediction, probably more than anything else. But I would say, if you think about the world population trends right now and how the population is growing, not only growing but also migrating around the world. So in Canada, we're growing mainly by immigration, and we're seeing these populations come into Canada. It's unrealistic for us to expect that we're going to be able to build similar infrastructure today that we have today to meet the demand of healthcare in the future. So building hospitals and building more facilities is probably not something that the public purse can continue to fund. So the way we deliver care is going to change, and it's going to change. Instead of being telemedicine, I'm going to call it virtual medicine, where you'll have access to providers and care in the digital world as opposed to physical world. And it's going to change the way practitioners practice, and it's going to change the way we consume basic healthcare services. You will still need facilities for acute services, but I think in the very near future, you're going to start seeing a transformation of primary care delivery to the virtual world. The other aspect of that is that we're now seeing an aging population on the clinical practitioner side, and it's not realistic in Canada or even in the Western world to expect that we can replace all those care providers that are going to be leaving the profession or retiring with sufficient growth to handle the new demands of healthcare. So we can expect that we're going to see pressure on the providers as well. This is where I believe AI is going to supplement those providers in a greater capacity. As well, those developing nations, mainly in the Far East, where you have a lot of population and education systems that are able to support more providers, you might see some of our care being delivered offshore. So I see that the technology is going to become more and more capable of diagnostics, collecting personal data, providing better primary care services on the management side to people without having to interact with the physical system.
Interesting. So we are getting to our final bottom of the hour. And I really, really want to thank you for your valuable time and sharing your experiences with our audience. As we wrap our call, any final words, things that you see happening within our healthcare space, the way care will be provided, and any challenges that we need to overcome?
Yeah, the first thing I would like to close with is that I'm pretty optimistic about the way that the healthcare system is going to evolve with digital transformation. And I believe it's primarily going to be driven out of the consumer as opposed to the system. The system is going to have to catch up. The one concerning note that I have is the political landscape today is very divided, and there's lots of opposition on imposing change and trying to bring the healthcare system to where it needs to be. And I find that the political system is not really addressing what the population is looking for. So I think that there's some more consumer pressure that's going to come to bear that's going to make it so the system will transform itself. I don't think that the transformation is going to come from within. It's going to come from external forces. But I'm excited by all these developments and the technologies around how to better manage my own care. And I think it's going to make it easier for us to manage care for ourselves, our children, and our aging parents. So it's going to make it easier with the advent of all this technology. I'm a little concerned about where that data is going to sit and where it sits in private hands. And I hear a lot of conversations around that today with all the things that are in the news. But I think those will be resolved. I think governments will put legislation in place to protect privacy to the best of their ability because they can't always keep up. But I'm optimistic. I'm optimistic that this is going to be a good thing for the health of our population, and especially those who are in areas where they can't afford to have these high acute care facilities. The technology is going to bring some good care to them.
I completely agree with you, Jock. I do believe that patients need to have more control over where and how their data is stored and used. And I do agree with you that government agencies um, uh, need to set out a clear patient-centric, patient-friendly policies that lays the groundwork for how data needs to be shared, it needs to be used, it needs to be managed. With that, I want to thank you again for sharing your insights, the various conversations you're having with the decision makers, both on Canadian as well as on your side, and your time.
Well, thank you for having me. This was it was fun to do.
Thanks. Pleasure is all mine. So this is where we will stop.
Okay.
And now the editing challenge will come in to make sure that we properly divide it into two sections. And